Hello everyone, I'm Shasha Han, Assistant Professor in Hydrology from University of Birmingham at UK. So today I'm going to present on behalf of my team on enhancing flood forecasting system in India to support healthcare and strengthen community resilience. So this project is funded by National Institute for Health Research. So the aim of the project is stemmed from the current limitations in the flood forecasting approach in India, which normally have limited spatial resolution and short lead times, and only mainly focus on the major rivers. And there is also a lack of integration between weather forecast, flooding inundation modeling, and the healthcare planning. So the aim of our project is really to develop an integrated meteorological hydrological forecasting system to substantially improve flood prediction in both lead time and accuracy for two states in India. And we will also try to identify the impact-based flood threshold for flood vulnerable areas, which can trigger healthcare interventions. And our study areas are focusing on two states, one in Kerala and one in Bihar. Those two states are very heavily affected by floods, but they got quite distinct flood characteristics. For Kerala, it's a hilly terrain, and the flood mainly contribute from the heavy rainfall, steep slope, flash floods, and urban waterlogging and poor drainage. On the contract, Bihar is quite flat, and it got a quite low elevation. And the flood mainly from the overflowing rivers, the transboundary floodwater from Nepal, and the gentle slope larger floodplains. So our study focusing on the most affected district in Kerala states, and we developed the flood risk map at primary healthcare center level, and by integrating data from different sources including flood hazard factors and flood vulnerability factors. So flood hazard factors, we consider the elevation, the slope, the distance from main river network, and also the density, the drainage density. For flood vulnerability factors, we consider population density, the road-river intersection density, and the healthcare center density. And all those data will be combined together and assign different weight to develop these flood risk maps, which you can see divided in 3 different levels. In parallel, we also collect the flood impact data from community via surveys and questionnaires by asking what's the flood impacts on healthcare and the flood control measurements and explore time, etc. So moving forward, we will develop an integrated meteorological hydrological forecasting system, and also trying to understand how the risk might change in the future. Thank you very much.